Hello, and welcome. Today we're delving into renal pelvis carcinoma, a cancer that originates in the lining of the renal pelvis, the funnel-shaped area of the kidney that collects urine. While the exact cause of renal pelvis carcinoma remains unclear, several risk factors have been identified. Smoking is a significant contributor, increasing the risk substantially. Exposure to certain industrial chemicals, particularly those used in the dye, textile, and rubber industries, has also been linked to the disease. Additionally, a history of chronic urinary tract infections or bladder stones can elevate the risk, as can long-term use of certain pain medications containing phenacetin. Some genetic factors might also play a role, but these are still being researched. Renal pelvis carcinoma typically arises from the urothelial cells that line the renal pelvis. These cells, normally responsible for protecting the kidney from urine's potentially irritating components, can undergo genetic mutations, leading to uncontrolled growth and the formation of a tumor. This tumor can then invade surrounding tissues, including the kidney itself, and potentially spread to nearby lymph nodes and distant organs through the bloodstream or lymphatic system. The grade of the tumor, which reflects how abnormal the cancer cells appear under a microscope, is a critical factor in determining its aggressiveness and potential for metastasis. Renal pelvis carcinoma is a relatively rare cancer, accounting for a small percentage of all urinary tract malignancies. It's more commonly diagnosed in older adults, typically between the ages of 60 and 80. Men are affected more frequently than women. While incidence rates vary globally, certain geographic regions with higher rates of industrial pollution or specific dietary habits may show a slightly increased prevalence. The most common symptom of renal pelvis carcinoma is hematuria, which is blood in the urine. This can range from barely visible to quite apparent. Other symptoms may include flank pain, a palpable mass in the abdomen, or frequent urinary tract infections. In more advanced stages, patients might experience weight loss, fatigue, and bone pain if the cancer has spread. Diagnosis usually begins with a thorough medical history and physical examination. A urinalysis is performed to detect blood or abnormal cells in the urine. Imaging tests, such as a CT scan with intravenous contrast or an MRI, are crucial for visualizing the kidneys, renal pelvis, and surrounding tissues to identify any tumors. A uroscopy, which involves inserting a thin, flexible tube with a camera into the ureter and renal pelvis, allows for direct visualization of the lining and the possibility of obtaining a biopsy, a small tissue sample that is examined under a microscope to confirm the diagnosis and determine the cancer's characteristics. Renal pelvis carcinomas are primarily classified based on their histological type, with urothelial carcinoma being the most common. This type is further graded to assess its aggressiveness. Other rarer types include squamous cell carcinoma and adenocarcinoma. Staging, using the TM system, describes the extent of the cancer, including the tumor size FT, lymph node involvement SN, and distant metastasis MM. This staging system guides treatment decisions and provides prognostic information. Treatment options for renal pelvis carcinoma depend on the stage, grade, and overall health of the patient. Surgery is the primary treatment for localized disease and typically involves a nephrotorectomy, which is the removal of the entire kidney, ureter, and a cuff of the bladder. For more advanced disease, chemotherapy may be used before or after surgery to shrink the tumor or eliminate cancer cells that have spread. Radiation therapy can also be used to control pain or treat areas of residual cancer. Immunotherapy and targeted therapies are also emerging as treatment options for specific cases, particularly for advanced or metastatic disease. While there's no guaranteed way to prevent renal pelvis carcinoma, reducing risk factors can help. Quitting smoking is paramount. Minimizing exposure to industrial chemicals, particularly those known to be carcinogenic, is also important. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, can contribute to overall health and potentially lower the risk. Addressing chronic urinary tract infections promptly can also be beneficial. The prognosis for renal pelvis carcinoma varies significantly depending on the stage at diagnosis, the grade of the tumor, and the overall health of the patient. Early detection and treatment generally lead to better outcomes. Recent research is focused on identifying new biomarkers that can help predict disease progression and response to therapy. Clinical trials are also exploring the effectiveness of novel treatments, such as immunotherapy and targeted therapies, to improve outcomes for patients with advanced disease. Ongoing advancements in surgical techniques and systemic therapies are continually refining the management of this challenging cancer.